Is Debbie Allen online?
No, you probably got another 5 minutes.
She comes late to that.
Yeah, we have Strathman and Nick Paul online.
He sold his house in Elgin.
Iqbal?
Yep.
Good morning, everybody.
Good morning.
Yeah, I was wrong. Miss Allen is here now.
All right.
Wait, is that Deborah Allen without a hat on?
I just feel a little awkward wearing a hat in my house.
I've never seen you like without a hat. You look very beautiful.
Oh, you're unduly kind. I'm trying to figure out how to make this thing work so that it is a little less intrusive. I think I need
I've seen
to.
her without a hat in here a couple times.
Oh, really?
She
Did
took-
the wind blow it off?
No, she took
air
it off for
conditioner?
some reason.
Morning, Deborah, or Debbie, as some people call you.
Hmm.
Do you prefer Deborah or Debbie?
Well, I'll answer to most of those. I was probably a Deb most of my life until I married an Arthur. And then it's like, it's like Richard and Liz. It just didn't roll off the tongue appropriately. So we became Arthur and Deborah.
Arthur
So I
and
have to-
Deborah. That sounds
though I
kind of
have to-
royal. That sounds sort of like royalty.
See?
There you go.
Questions?
Everyone, with Jamie joining us, let's call the meeting to order at 9:02. An attendance.
Alan,
Alan, present. Cliff, would
Bates?
you be willing to use your microphone a little closer?
You know, I'll even turn it on. How's that? I'm so sorry.
Wow, that's like magic.
She doesn't have a hat on, so she can't hear.
That's she has hearing aids in her hat.
That's
Miss
a
Bates?
good idea.
Here,
Davis,
Davis will not be joining today.
Iqbal,
Iqbal present.
Kenyon,
Here.
Lewis.
Lewis here.
Thank you. Mr. Sturgis.
We have quorum. Mike, could I have a motion to approve the minutes of June 9th,
I would like to
2021?
approve the minutes.
Mavis seconds.
David seconds.
Any conversations? All right, can we do that via consensus? Any objections to accepting the minutes? Online?
Mr. Shepherd has
Minutes are
some,
approved. Any public comment? I don't see anybody in the room or online. Thank you very much. Monthly financials we have available in our packets. Are there any questions for those? Online? Thank you. Jake, Veterans Assistance Commission.
Well, good morning. Thank you, Mr. Chairman. For the month of May, we're talking about today, our compensation claims lagged about a day behind in processing time, the average compensation claim in the state of Illinois. I attribute that to mainly the COVID stuff and records delays with the VA. Nothing I'm too concerned about there. Our pension claims are going a dozen days faster than the average, so very happy with that number. The inventory for claims in the state of Illinois, 12,000 claims pending in the state of Illinois, 169 of them belong to our office. Our number's fairly healthy there, but the overall 12,000 claims pending, that's the highest it's been in years, dating back to when everything was still paper-based 5 or 6 years ago. That's a pretty high number, and that's going to have effects on that trickle down to us as far as timeliness and getting claims processed in a timely manner by the VA. In the month of May, we filed 32 disability claims to the VA, 8 claims for dependents whose veteran died of a service-related disability. 2 survivors pension claims, 2 applications for healthcare, which is the lowest number we've had all year. You might remember in the beginning of the year, we had a lot of folks very interested in VA healthcare that had never used it before in the interest of getting a COVID shot. So we had very high peak numbers at the beginning of the year, and now those are starting to trickle out. And then we filed 1 appeal in the month of May. 159 forms completed total, and our clients received $372,000 in new benefits. That brings our fiscal year to date total to over $2 million in new benefits awarded. That's cash that actually goes to veterans on a monthly basis, and then is spent here in the local community. One thing that we don't generally report on, but in the interest of keeping my report not so mundane, there is a whole bunch of other things that we do that we don't report on. So for instance, when one of those folks gets their disability claim approved, there's a whole host of benefits that go along with that, state and federal benefits. And I'm not aware of any other Veterans Assistance Commission in the state of Illinois that does it, but we'll actually sit down with the client and do a quality review of the decision to make sure that the VA made the correct decision. And if we have to go back on it, we will. But we also go through what we call our ancillary benefits checklist. So veterans who get a disability rating at 10% or higher are eligible for a free hunting and fishing license from the state of Illinois, half price rides on Metro and Pace, free access to the national parks. And we'll go through all of this. And if they're interested in any of those things, we actually execute those applications on their behalf and get those ancillary benefits as well. So just want to make you aware of that, something we don't generally report.
Jake, I oftentimes, and people have heard me say, I oftentimes look at things in terms of thresholds. You're either satisfied or dissatisfied rather than giving them a grading scale. And what you call mundane, you always perform well above threshold. But it's these other services truly that separates your office. And I know you're downstairs in the dungeon in the basement, but you I mean, it truly separates your office. And I think that for our committee, hearing those things, you know, the stories of the fellow in Elgin, the checklist that you go through over and above, I think those are so vitally important. And I do want to remind this committee that as we're entering budget season, all too often we're hearing, well, if you compare our Kane employees versus other Collar County employees, we're paid under scale in many areas. Well, in Jake's particular case for the VA, it's not under scale, it's grossly under scale. And I do believe that we need to find a way to bring that forward. And I've mentioned, this is the 3rd meeting in a row that I'm mentioning it. And I don't know, have you had your opportunity to speak to the board and make presentation?
No, it'll be the next committee of the whole. meeting.
And are you addressing that there, or do you need advocates for you?
So it's something that I've actually not advocated for, and actually
I know you haven't.
advocated against. However, the commission, our oversight body, you're our fiscal oversight body, but our operational oversight body, it's something that they won't let me tell them no on any longer. I think that's a discussion I've tried to stay out of. I think it's not appropriate for me to be in that discussion. I'm not sure what their intent is. It's not in the budget that they passed or the budget I'm presenting.
Okay, we should probably have a discussion on that, because where it's not your purview, it is absolutely my purview. And I believe your fellow commissioners here, I will challenge anybody to come up with a negative that we've seen from your group in any way, shape, or form. And we do, while we don't answer to your other host body, it is our objective to work hand in hand with them, and to ignore their requests would just not be appropriate. So I do want to hear that. And the reason I bring this up publicly is that Jake won't. I mean, politely, this is the most humble individual I've ever met in my life. And I want to make sure that we're advocating where it needs to. Squeaky wheel gets the grease. It's time for us to get the grease gun out. So, if you will. Mr. Kenyon.
I'm wondering about veterans and the medicines that they have to have. How are they, do they get that, or Does it depend on the level of disability?
So anybody that's enrolled in the VA healthcare system, there's different qualifiers to get into the VA healthcare system. For instance, somebody who served in the Republic of Vietnam is automatically eligible based on the exposures and stuff that they experienced there, Agent Orange and so on and so forth. Whereas veterans who served completely during peacetime or stateside, oftentimes there's not a special qualifier for them and they look at income. So regardless of that, whatever qualifier it is for them to get in the system, and that's where the rubber meets the road for us, as we're trying to get them in the door for that. That's what our job is to do, is to get them qualified for it. If there's a way and they're eligible, we will. But once you're in that door and eligible for the VA healthcare system, it's a complete package, except for dental care. So if they need hearing aids, they're able to get hearing aids. Medicine, it's all mail order. Actually, Hines is a kind of a regional distribution center for a lot of other VA hospitals. So for instance, I have Blue Cross Blue Shield through the county, but I use the VA myself. And the medicines I take, the maintenance medications, I go online, log into my system, and then I get them in my mailbox 7 to 10 days later. So it's a pretty good program. As far as medicine goes, it's $5, $8, or $11 for a 30-day supply. There's only 3 tiers of medication, so the most a veteran will pay for any one medication is $11 for a 30-day supply.
I know a few veterans that have gotten, diabetes. They were exposed to Agent Orange. And in fact, I know a couple of men are 100% disability. And they've all spoken positive about the Veterans Association, the system which used to bury people. And I think things are on the way up for some of them.
I agree wholeheartedly. I tell people all the time, it's not my grandpa's VA. So.
Michael, thank you. Any other questions for Jake? Jake, you had mentioned consistently through the COVID that the archiving file system was manual, and because of the lack of human interaction, that was causing massive delays. Has that caught up at all?
No, it's still the case. Yeah, it's very unfortunate, and the VA, and it's not the VA, to be honest, it's the National Archives and Records Administration. The VA relies on them to get those records, and there is still, I think the last I checked, about 500,000 records delayed. In the decade, more than a decade I've been doing this, that organization has been a very highly reliable organization, turning around records in 6 to 8 weeks on average, 4 to 6 weeks sometimes. Talking 200 pages at a time that need to be redacted because in some instances there's other people's information in those records, to a complete, in March of 2020, just a complete opposite, where they're not highly reliable and not to their own fault, but they need to figure out another process.
So fair to say that could be
2021.
another 6, 8, 12 months.
Yeah, I think they even said longer than that, perhaps.
Okay.
Yeah.
Okay. Jake, thank you so much.
Thank you.
Question,
Amy.
Mr. Chairman?
Yes.
To the point you were making, or maybe
First
it's a
name, please.
follow-on.
Last name. Who is
Shepro,
this?
sorry, Shepro,
Recognize that voice?
Protocol.
yes. Has the waiting period at Hines gotten any better? I know for years, I heard the press would report that the way you moved up on the waiting list was at Hines was that the people in front of you died waiting for appointments. And I know there were lots of shuffles around management and the Veterans Affairs Department. Has that improved at all?
Yeah, so it's improved drastically. And my mention earlier to it's not my grandpa's VA anymore is when I got out of the military in 2009, my grandpa told me, if you want to go to the VA for an appointment, make sure you have the first appointment of the day. Otherwise, you'll sit there all day. And that may have been the case to some truth back in 2009. The kind of nexus of changing that, unfortunately, was a waiting list scandal in 2016 at the Phoenix VA Medical Center, where they were maintaining a secret wait list of veterans that needed procedures, and some of those veterans on that wait list died. That obviously had political repercussions. There was some privatization of VA services to expand capacity. More money pumped into the system, and I'm happy to say that that did not happen at Hines. They did investigate it there because The lady who was running the VA in Phoenix was previously the director of the Hines VA hospital, so there was quite a bit of scrutiny on that. But no, that's not happening, and I'm happy to report if I submit an application this morning for somebody for VA healthcare, they will likely be enrolled and able to schedule an appointment today to get in. And then also to receive their care, the wait times are very, very reasonable.
Wow, thank you. That's very encouraging.
Ken, great question. Thank you so much. Jamie, why don't we move to Department of Human Resources Management?
Okay, first report on file is the monthly Blue Cross Blue Shield invoice. Fairly standard month, nothing out of the ordinary here. Next report is the Blue Cross Blue Shield MERP enrollees. Numbers have been holding fairly steady. Does anyone have any questions about the invoice or total numbers?
So observation is that MERP is up 5 people on average from years prior. Is that accurate maybe?
It's been pretty steady between 50 and 60. It fluctuates a little bit, but yeah, I do think we had a few new enrollees in the last couple months.
Thank you. Sorry.
No problem. Next report is the Assured Partners report. And page 23 would be this year's numbers. So you can see this month we put money towards reserve. If you look in the upper left corner, the total reserve is for the year is about $256,000 behind, but there's a note at the bottom there from Assured Partners that that reserve total doesn't include a reimbursement for overcharges. So we actually are about flat for the year. We have 1 month left, but in a lot of cases, July tends to be on the low, June tends to be on the low side because we've hit our stop loss in a number of cases. So it tends to not be quite as high. So I expect us to be roughly flat for the year.
And for question, the reserve that we're seeking to hit in an overall capacity, Mavis, do you know the answer? For $1, what's our reserve goal? Deb?
9 million.
9 million, there we go.
Thinking 9 million, but how come we're?
And Jamie, how close are we to that goal?
Our current reserve balance is $7,629,000.
And folks, that is an enormous stride in the 18 or 20 months that we've been, focusing on this. And again, I want to acknowledge, Mr. Brown and to everybody else in the room, that $9 million, there's no magic there. It's just a number that Mike Baker, Joe Onsick, and I thought was appropriate. There's no math behind that. Nobody came with regulatory reasons. It's just a number that we felt comfortable with that we should achieve. And we're working our way there. We're within a year or two from being there. So sorry, Jamie.
No problem. Within the fine print of that too, at the end of the year, we expect they have 122,000 reimbursement expected at the end of the contract as well. So I think we're pretty safely going to be flat or a little bit on the plus side for the year.
Perfect.
Next report is job applicants. Applicants are good. We're getting lots of applicants for individual positions. There's a new hire report. Total new hires was 14. Those appear to be replacement hires.
Question, please.
Bates.
So people, on the news, it says we can't find workers, employers can't find workers. Are we having good application rates?
It's definitely low. It's definitely a systemic problem right now of getting good qualified applicants. So I was happy to see that the applicant report we have did have a number of applicants for our position. I can tell you, like building management, I'm sure it's relative to the pay for those positions, and I believe that's under review right now. 0 applicants for some positions that are open. But circuit clerk got 10 for an open position. That's pretty good.
Good.
Agreed. And Mavis, I will advocate for the business community that, the complaint that I hear the two complaints that I hear in tandem left and right is that we just can't find anybody. Whether it's on Indeed or a headhunter or wherever you want to go, the number of applicants for the desired positions out there are slim pickings. I mean, I know insurance agencies that are considering closing because they cannot restaff. You know, and you know, when you go to a restaurant and, you know, if you have 2 legs and 2 arms and you breathe, you're hired because they can't get
They hire you on the spot.
on the spot. It's really not a good thing. And then in more of an office situation, I've made this comment again and again that the crisis we're having isn't the employees themselves. It's the childcare for those employees.
Which is what ARP committee is looking at.
And let me tell you, it is a bigger deal than, and I am the child of a mother that was an early preschool administrator. And I understand the importance of the Head Start programs and stuff like that. And I am a huge advocate for that. But never before I'm 57 years old and I've never seen this before, where employees are just point blank, we can't work in the office because our childcare is not stable. And no offense, but I am a Christian employer and I believe that you work for your family, not vice versa. And there's a cause and effect there. And when you can't be assured that your children are safe and being taken care of, that really underpins the foundation that your family value system is based on. And it's really, I don't have an answer. I know the question, and honestly, I don't have an answer. And I encourage everybody to continue to work on it. And for those families in those cultures where the grandparents or other family members are rolling up their sleeves, God bless them. I mean, just God bless them, because I don't know that the preschool centers and other organizations are able to pick up the entire slack right now.
Many of them went out of business during the pandemic.
And it's just, I'm hoping that with some of this ARP money that's available, we find a way to maybe interject something there, but that's a different committee and a different, sorry, Jamie.
It's
I'm really
definitely-
good at going off target.
Definitely a sign of the times, though. I can tell you that 10 years ago, when I would post a secretarial position in the state's attorney's job that was an entry-level position, I'd have 100 people apply for it in a matter of weeks. Now you're lucky to get 10 or 15. So it's definitely way down from what it was years ago. So I'm hoping to see that rebound. I don't know if the unemployment benefits that are extended plays any role of if people are actively searching or not, but hoping to see that, move in our direction, have more options.
The articles that I have read on Indeed most recently are that we're going to force our employees back into the office, and those employees have responded by saying, super, I quit.
Yeah, it's come back to work or else.
Or else.
And
that's not
the employees
way.
say, I'll take or else.
I'll take or else, because honestly, I have 18 months worth of unemployment and the jobs are going to be there when we come back. And so, or else works. And by golly, that's, in my opinion, that's just a really bad thing for everybody. And that's just, sorry to interject my opinion, sir. Jamie, keep moving.
Cliff,
Yes.
permission to speak.
Who is
Louis
this?
here. Louis
Hi,
here.
Louis. You're the best.
I know, you're the second best. I do believe, that when we get our kids back in school full-time in fall, that will help a lot, because a lot of parents are forced to stay home because their kids are there. So I'm hoping when we get our kids back in school, then people will come back to jobs. So make sure that we all get our vaccinations and that we vaccinate our kids that can get them. There's my public service announcement for the morning.
Speak up, speak up.
Your voice fades out.
You're fading.
You're fading.
Anita, you're fading. Uh-oh, do we lose it?
Anita, are you still with us?
Now I am. Can you
There
hear me
you
now?
go. Yes, we can.
All right. So what I was saying was that I hope when our kids get back in school in fall, that the parents will be in a better place to go back to work, because a lot of them are staying home with their children, especially when they've been having to school their own children. So I think that's going to help, but we need to make sure that we're vigilant on these kids that are 12 and over getting their vaccines, because that's going to help.
Good childcare is family values.
There we
That's
go.
true.
Anita, thank you so very much.
Mr. Chairman, Shepro.
Yes, Ken.
I agree with those comments, but I think that really there is going to be a sea change in what constitutes the workday, going into the office, not going into the office. So many businesses are continuing with the work at home precisely for some of the reasons that have been suggested, is the workers don't want that. But you think about even the county. I recall some of our reports, you know, a lot of our, what I would call like maintenance expenses are down because we're not using as much electricity. We're not using other things. And I think that my son works for a agency that is kind of a captive supplier of the FAA. They moved into a new building a year ago, and not one person in that company has even been to the new offices. And they have no plans to go there.
I hear that time and again as well, Ken. Thank you.
Yeah.
Are there any other questions on the new hires, terminations, applicants reports? Okay, we'll move on to workers' compensation reports. Workers' compensation is continuing to trend down versus previous years. There's no new claims that are particularly notable. We are making an effort to review and, if possible, close some of the older claims that have been on the books for a while and get those settled. So we are seeing some settlements going through in a deliberate effort to close some of those that have been on the books for a few years.
And again, Jamie, I always get a kick out of the fact that this meeting is directly after the board meeting yesterday, where we go into executive session and discuss large settlements. And then we come and report to you folks, oh yeah, we're doing great. And it's always such a compare and contrast. And you know,
A lot of those settlements that you're seeing are for injuries that occurred many years ago.
Years and years. I get it.
So,
It's just-
and it is, we are making an effort to try to get those closed out and get them off the books so that we can, move forward and analyze our current claims. But I believe our current claims are well managed by our current vendors.
Thank you.
Question, Shepro?
Yes, Ken.
Are the reason for the claim decreases increased, workplace safety and education, or is it that people don't get hurt on the job when they're working from home as much?
Ah,
I don't believe, to answer that question, I don't believe that we've seen a frequency spike or drop in the work from home scenario. If you look at where our claim cases generally come in, those departments weren't affected by a work from home scenario.
So really, like the sheriff's office is an example where that would be true. It's not.
Trying to be tactful, yes,
Well,
correct, yeah. Yeah, where the claims are coming from are indicative of they were not at home, so.
Right, both the sheriff's office and court services, the juvenile justice center, which staffs the juvenile detention facility, are the bulk of our claims.
Right.
And they're really unavoidable. They're just a matter of circumstance.
Sure. Mr. Brown.
Brown here. Does that work? That doesn't work. Why don't we throw that one mic away?
Brown here. I just have a question kind of related to the workman's comp. Does the county have a safety officer, or do we contract out with a outside safety department that comes in and teaches and inspects and such, or no?
We don't currently have a vendor that does that. I can tell you that our process as far as human resources, I review those claims when the reports come in. And if I see anywhere where there was some kind of safety violation, or I see a hazard that resulted in the injury, I will contact the department. For example, we see this a lot in the winter, and I'll get a report in that someone slipped and fell in the parking lot, and I will contact building management and make sure they've cleared the ice and cleared the location. So I try to make an effort to do that. Like I said, the bulk of our claims come through the Sheriff's Department and the Juvenile Justice Center in cases where they were assaulted by someone, or sometimes it's car accidents, the sheriff's office is in a pursuit or something of that nature. They really are just by the nature of what they're doing, unavoidable.
Not really something where training would improve on the situation.
No, we're not seeing
If
a
I-
large number of OSHA violations or issues where it seems like training or safety training would be an issue.
If I can, I don't think I'm out of bounds in communicating that it is, when Sheriff Hain came on, there was a definite cultural change in the relationship between human resources, our claims counselors, and claims adjusters, Ron's department from the top down, and a willingness to participate. Understanding that I'm a super simple guy, we called it shining a flashlight into the darkness and trying to figure out and boil it down and get to the analytics of the data to find out where these claims are coming from. And instead of stonewalling us, Ron rolled up his sleeve and picked up a flashlight, and we went into it. And what we discovered from that is there were some obvious areas within buildings and grounds where we said, we need to put a camera here, we need to change a layout there, we need to do something to improve it to make sure that perennial infractions were being curtailed. But then we went one step further and analyzed that we really did need to make an additional hire to bring on an additional claims adjuster onto our team. And Dora took the step to bring that person on. And in my opinion, that's been the single largest clearing of the log jam. So while the individual that you're asking doesn't exist, in a way it does in the methodology that we went about it. So we were able to go back to those department heads and say, this is what we're seeing, how can you help us? And through a series, I mean, it took us about a year and a half, the results speak for themselves. We're doing well. Now, I will tell you that this Friday, there is a lunch scheduled. I don't know that Madam Chair has actually had the privilege yet of meeting Rich Ryan, who is our general liability person, broker, Dora, our workers' compensation specialist, Mike Baker's team, although Mike won't be there, he's sending Michael, whatever Michael's last name is, to meet with us, to make the introduction so that Madam Chair and whoever else would like to join understands the role of our outside professionals, understands the self-insured nature of the beast that we are at the county and how those parts integrate. And the impetus of this meeting is that Rich Ryan had just as an example, Rich Ryan had reached out and said, as you may or may not be aware, the county had some large claims back a few years ago, which jeopardized our ability to obtain insurance. 47 out of 50 vendors that we deal with turned us down. We won't even bid on you. The one that we did get was Trident. Yay. We went a couple of years clean. Prices began to fall and come back in line. Trident made us aware that their reinsurer has pulled from the market. So they are losing their reinsurer for us. People that are outside the insurance industry don't understand that there's a primary carrier that will take on the first couple of million, but all the millions after that are through a large reinsurance carrier. Without that carrier, Rich now needs to roll up his sleeves and go find somebody that will take us. That was no fault of ours. That carrier made a strategic decision to pull from the market. As we enter that, I think it's an appropriate time to introduce Madam Chair and Jamie and a couple other players that may not know who those professionals are, how they work for us and what we do. But I would be happy at that time to speak with Dora and say, Do you think we need that compliance person or that?
Yeah, I find it interesting and I don't know what the right answer is because certainly our main objective is to make sure everybody goes home safe at the end of the day, at the end of their work day. But, and I don't know what other counties do, but for example, St. Charles Public Works Department has recently created a position of a safety officer that goes through compliance. City of Naperville, I know, has 2. So I wonder, don't forget the fact, because obviously health and safety is the most important thing, or going home safe is the most important thing. But I wonder what the cost benefit of that is and how that would work out. And I just, I'm
Have
not
that discussion on
advocating for
Friday.
doing it. I was just curious as to whether or not we do that and we don't. So.
Right, and having a risk management person, generally speaking, can be, very worthwhile and can save money in the long run. So a lot of organizations aside will have a risk management person. We have the additional challenge, though, that our elected officials have to choose to utilize that staff person. So since we can't compel them in any way, they would have to sign on and, agree to have that person evaluate their operations and then participate in that interactive risk management process.
I think as a steward of the tax dollar, and I hate that phrase, but I can assure you that the additional staff that we have requested has always proven to save more money than being spent. And we would be happy to run that analysis to see what the outside team thinks the merits of doing that are and report back.
Something to think about.
No, absolutely. And it's a great conversation for Friday. So, Mr. Kenyon,
Mr. Chairman,
Kenyon first.
Forest Reserve has a safety officer, and throughout the year, they conduct training. Of course, they use chainsaws a lot. They train the rangers, and they also train the people that volunteer to help. So they've found that to be, like you say, it's worth the dollars. And this man came from the railroad industry. He retired and he's been over the safety chuck, we call him.
I will suggest, Ken, I'll come to you, but we really need to keep this meeting moving this morning. We have some other things to get to.
I'm just giving you an knowledge.
No, and just to let you know, Mike, one of the challenges that I perceive that we've had in the past and will continue is that while we would love to bring that person on if it was prudent, remember, we're dealing with other county-wides that don't have to agree.
Well, I'm sure the transportation people should have that because they're in a realm where they're out exposed to crap.
And I agree. So whether it was judicial or whether it was transportation or what, I don't care if you're driving a snowplow or if you're chasing a guy down the street. There are some inherent risks there. And we would need to have buy-in from those departments.
They don't take well to suggestions.
Just saying,
Quote me on that.
conversationally, we would begin to float that and see where it might go. Jamie, Ken, did you have something else?
Something you said, Mr. Chairman. We got a lot of new board members, and I agree with you that I have a feeling that many of us, and maybe some old board members, don't really understand how the insurance system works for the county. And that might be a good topic for a short course at Committee of the Whole or something where we all get the benefit of that explanation, because I think you're right. That's a good part of the risk management, and I suspect a mystery for too many people.
And just to put things in perspective, because you might hear Ken's comment and not understand where he's going with that. Our Blue Cross Blue Shield bill is over $16 million a year. Our liability insurance doesn't quite rival that, but we're well up there. So when you start speaking in terms of $20 million, $25 million, I'll sit up and listen. And that's what, Jamie and the department are charged with. And that's what we try and manage. And that's what this committee is. Nuts and bolts, that's where we're coming down to. So Jamie, thank you. Keep moving.
Are there any further questions on workers' comp or insurance? Okay. Next item on the agenda is training. So the monthly training report is on page 37. It looks like our numbers are good. We have, 865 done out of 1,200, but that number's been pretty flat for the last couple of months. So we had a nice spike at the beginning of the year with everybody that just wanted to get it done. It's been flat for some time.
Strathman was really upset that her name wasn't taken off the list on that. Do we not have that glitch worked out yet, or?
So it's not really a glitch so much as IT has a pretty nice system for us that if you follow all the steps very specifically and you go all the way to the last page and hit next all the way to the end, it automatically removes your name.
So it's possible that Cheryl was just,
Well, she may
A
have
little
taken
loopy
it
that
and
day,
just,
yeah.
it doesn't look like you need to hit next to the last one. It looks like you're done. And if you don't hit next on that last page that says congratulations, it doesn't
I've
actually
baited her
mark you
twice now
off.
and she's not jumped in. So that's interesting.
So if someone closes
like to
that
pick
window
my
before
battles.
getting to the last page, it doesn't take them off, but we just take them off manually. So if that happens to anyone, they just need to let us know and then we can go in and record that manually. So.
Cheryl?
Yes, Cliff. Thank you for the information.
Jamie, my point being, I'm just wondering how many of these might be completed that aren't marked as completed. And then do we have a game plan? Because we really would like to wrap this up August, September, and not take this to the wire. We're not anywhere near our compliance numbers yet.
Correct.
So if there's something that we can do, or that let's canoodle that between you, me, and Christine, and just try and figure out something that we might be able to.
I have come up with kind of a game plan, so that's kind
Okay.
of what I wanted to talk about a little bit. I propose that we send an email to all staff in late July and let them know that this needs to be completed by August 31st. And make sure we get everybody in, because the statute does require that all employees, not 90% or anything like that, but that every employee does take this training. And so it is mandated by statute. So if we send an email telling them they have until August 31st to complete it, I'm hoping that we'll get a lot more in then in that month of August. And then after August 31st, we will pull the list of actual names who have not completed it. And we will send an individual email to them indicating that they haven't completed it by the due date and they need to have that completed. We'll give them then 30 days again by September 30th, or the list of names will go to the department heads.
How many of your short, I'm not sure that being nice about it, I think I might go to Nastygram and say, hey, you need to get this completed. And I mean, we've been nice about this, and I am one of those infractors, but I just do it to see how long, what the system looks like. And it's just an email that pops up every month that says, hey, you still haven't done it yet. It's time to, we're not asking. This is legislatively needs to be complied with. Help us get done. We don't want to do this every month.
Right. So that's what I was proposing. We send in late July. It would come from the human resources email rather than from the system. So it wouldn't be a system email, but it'd actually be something that I write and say, this is a legal compliance issue. You are required by statute to have this completed by August 31st. And I'd like to think that that gets the majority of the remaining people moving in the right direction. And then we'll handle them on an individual basis following that August 31st deadline, and send an individual email.
You could incentivize, like lunch with Sanchez or something. You could
Hey, as long as
incentivize
Sanchez is
that.
buying, it's fine with me.
So
Tacos.
there we go. And I only say that
Mr.
because
Chairman?
I just saw Jared pop on, so I'm sorry.
Mr. Chairman.
Mr. Chairman, I do have another question.
Yes, ma'am.
Since I
Last
didn't
name?
hit the Strathman with the question, since I didn't hit that last page and complete it, is the best way to follow up now is just to call HR and take my name off?
Yeah, call or actually preferable if you send an email to either me or Christine Miller or just to the general HRM email so that we have in writing your statement that you did take the training. And then we
Okay.
would use that in place.
Okay, thank you very much.
Perfect.
Mr.
Jamie, is it
Chairman?
okay for us to move on to the employee
I
appreciation?
have a question.
Oh, I'm so sorry, Mavis. I'm so sorry.
I have a question.
Go ahead.
Every day.
Yes, to make things more clear. So I know I did this. I know I took the sexual harassment, both of them. I'm not sure if I took it before December 31st or after December 31st. So if I took it before December 31st, that doesn't count for this year. Is that correct?
Correct. You'd still be getting the emails if that were the case, because the system was reset on the first of the year.
Okay, so we will, all those emails are do not reply, correct?
They are, yes. That's a system
So that
email.
makes it hard to ask a question or, the question I just asked you. All right, so, but someday if somebody hasn't completed, they will get an email that does not say do not reply.
Correct. That's what I'm proposing. We send in July. So I would send that from our human resources email account. They can reply to that one. And if they have a question, or if they want to say, hey, I took this on such and such date, I don't know why I didn't take my name off, we would be able to address those
Okay,
on a
great.
case-by-case basis.
Okay, thank you.
Perfect. Okay,
Some of-
moving on
most
to
of the
item
questions-
8A, Employee Appreciation and Recognition Picnic. Jamie, do we have an official date for that now?
And we're looking at August 19th at noon. We did send that out to department heads to get their feel for it. We discussed the possibility of after work versus lunchtime, and pretty much polled all the department heads, and it was pretty unanimous that the preference was for lunchtime. And August 19th seemed to be a good day. That's a Thursday. It seemed to be a good day for everyone.
There has been conversation that you are expecting possibly, or we are budgeting for approximately 600 people. Is there any way for us to reach out to department heads to maybe get a better feel for that number? And I, in the words of my pastor, I tell you that to tell you this. We have funds available of $1,000 from county monies that are used for employee appreciation. And we have $20,000 of non-taxpayer money that came from vending machines that's accumulated over the years that we would like to use for this one-time inaugural, post-COVID, let's get everybody back going again picnic and a 20-year, 30-year appreciation of employees celebration. However, I want to make sure that we're using, just because there's $21,000 available, what's the appropriate amount of money to use from that? I might suggest half, but the bids that we're getting in from food vendors seems to be in excess of that. So the variable is, how many people are you talking about? I mean, if you're only talking about 200 people, that's one thing. If you're talking about 800 people, that's another. And I think we're shooting at the hip of our 1,350 employees. We're expecting maybe 600.
That's the estimate that we're starting with, is 600. Our goal when we actually make a final decision on vendor and date and have everything squared away is to send out like an Eventbrite or something of that nature, where they will reserve their spot. It'd be no cost, but that would require them to say, yes, I'm coming. And that way we would have a more accurate count, or at least a maximum head count, where they would have to have that Eventbrite registration then to get their
I
food.
think for budgetary purposes, it probably wouldn't be a bad idea to throw an initial volley out there to the employees and say, who might be interested in this? Let us know. Because if the response is very low, that would steer us in one direction. If the response was overwhelming, that would steer us in another. And I just want to acknowledge that while Michelle Gums is not a member of the committee, Michelle has really rolled up her sleeves and helped us, immeasurably here, working with Jamie and Christine. And our price point for food is, as low as $10 and as much as $15, but one is all inclusive. They bring the tents, they clean up. The other one, some of our staff has to do it and help out and blah, blah, blah. And we're just trying to wrangle all that and make sure that we're staying within some guidelines, and there's guidelines that don't exist. So we're kind of, Wild Westing this one just a little bit for a first time. But I might suggest throw an Eventbrite or an invitation, out there, and just to see where this might go, kind of get that number in line. And let's start for this to take some additional shape. I think this is a great idea. I am so pleased that my contemporaries here, that most of the commissioners have all said, we are happy to down our chef's hat and help serve. And I just think that's the coolest. And Kenyon's
I
had
had a
almost.
uniform.
Yeah, Kenyon has an entire cook's gear.
Mr. Chair. Gums?
Yes, ma'am. Who is this?
This is Gums.
Hi, Gummy.
How are you? Hey, I'm donning the chef's hats that you'll all be wearing for the event right now.
Very
However,
good. Hey,
you will each
excuse
have
me,
a-
Gums, hang on a second. Hey, John, Martin, can you close those? We can't even hear. Thank you. Michelle, the weed whacker guys are on the outside of the building and our windows are open,
Well,
so we
that's
can't even.
pretty
yeah, hang-
typical for my life, yeah.
Okay, there we go. Go ahead. Thank you.
I
Sorry.
always get drowned out. Anyways, I'm donning the lovely chef's hats that everybody will be wearing when we have our lovely employee picnic, and they'll be decorated with some very creative and fun sayings on them. So just be prepared for those sayings.
Marvelous.
Yeah, it's.
They'll be entertaining.
They'll be entertaining.
Where's the-
I expect
Where's
nothing less.
Where is the picnic? Is it at the government center in the back?
Mr.
where it
Shepro, I
has been
believe
in the
that
past?
we are doing it here at the government center.
Yes, in the grassy area out back where there's the pavilion.
And we were informed by Mr. Froz that, you know, we did need to reach out to the Forest Preserve District and pull some permits and get things in order, and all of those steps have been taken appropriately.
My recollection is a little vague, but when we've had these in the past, I don't think we've had 600 people there.
In the past, there's always been a ticket cost to the employee for our employee events. So this one's
okay.
going to be offered at no cost to the employee, since we have that vending machine money we can take advantage of. I would like to see us use half that money and try to keep that total budget for this at that half mark, just to make sure we preserve the remainder of that money for any future employee events that we'd like to look at. My understanding from finance is that money accumulates very slowly, so we can't have a $10,000 event every year. So I think we should be able to throw a pretty nice party for half that money.
And again, let's see where, I mean, not spending money for the sake of not spending money that's accumulated for the express interest of going back to the employees. I don't mind spending it. I just need some, it's not my decision to make, and I just want it out there. And we have a whole bunch of other stuff to get to. I'm just bringing this as an update, and there's another committee behind us. And so if it's not urgent, this was just an update that's taking shape. Mavis, do you have a question?
No.
Okay. And Ken, that party wasn't thrown by Surgis and Gums, and we didn't have a party planner, Miller, helping us out. So this is going to be an extravaganza. So
I can't wait for you to see your hat, Mr. Shepro.
Oh, I'm looking forward to it.
I love the
How many
camaraderie. Jamie, anything
employees
else
are
on that at all?
actually, how many of our employees actually work out of the government center?
I don't know that figure off the top of my head, but it is fairly centrally located, considering we have employees in Aurora and employees in Elgin.
Yeah.
And a large number of our employees are at the Judicial Center campus. It's probably the largest location, but they also have a lot of traffic, public traffic, that I don't think that would be an ideal location, but they're about 10 minutes away.
Would we like get a, bus to bring people from KDOT or,
Shut him off. You're never going to get done.
No, but we are encouraging the department heads to, I mean, this is a camaraderie builder. This is, how'd you do post-COVID? How's your family handling this? How are we doing? And more importantly, we have a new crop of board members, if you will, that came on in the past 6 months. This is an excellent opportunity for those staff and employees and department heads to interact with those commissioners on a very casual basis. And, you've heard me, again, I'm a simple guy. Lot can be solved over a beer and a slice of pizza. So, I mean, let's just provide an opportunity for communication and see where this goes.
We've gotten a positive response from the department heads and elected officials when we polled them. So I think we'll have a good turnout.
I think that the identification of the two leaders of this enterprise inspire confidence that it will be an extravaganza to remember.
There we go. Jamie, moving on to new business.
Okay, the first item is a resolution authorizing the amendment of the Sun Life insurance policy to include optional death benefit coverage pursuant to the Kane County Insurance Benefits Policy.
Mr. Kenyon, can you,
Move that.
Ms. Bates, second? Any conversation?
No.
Roll call. Can we take these all as a group?
Yes.
Did Mr. Shepro just answer?
Just go ahead, roll call.
Okay.
Yeah.
Allen,
Alan,
Bates,
Bates, aye.
Davis, Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Lewis.
About 5 minutes. Lewis, yes.
Thank you.
Motion passes. Jamie, item B.
This is an
Mr.
audit
Chairman?
adjustment to our workers' compensation bill, insurance bill from 2020. So the payroll audit was completed and the insurance premium was adjusted.
Up or down?
It was adjusted up $16,623. Mr. Onsick has reviewed all the records and agrees with the change.
Bates
we-
moves.
So we owe more money.
Yes.
Got it.
And there's
Bates
budget.
moves.
I will
Alan-
second
Alan's-
Bates's motion.
Allen seconds. Any conversation?
thank goodness
Mr.
it's only
Chairman,
16,000.
Shepro,
Mr. Shepro.
just for future reference, the device of a unanimous consent can sometimes streamline the process and avoid roll calls.
Perfect.
So for
Ms.
example,
Allen, did you have a
someone,
comment?
yeah,
Deb?
I was just grateful that it's 16,000.
No, I agree.
What
and
did she
if-
say?
She was
Deb?
grateful that it was only $16,000, but
Right.
I've said this millions of times. Joe Onsick is a wizard. And to be able to be within $16,000 on a worker comp audit, that's projecting what your payroll is going to be across an organization our size. I got to be candid. We'd rather be
Voodoo.
returning 16,000, but that's really spot on. So
He does make that projection a full year in advance, so.
yes, so please call the roll.
Allen,
Alan,
Bates,
Bates, aye.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Lewis.
Lewis, yes.
Thank you.
Jamie, resolution C.
This is a resolution authorizing personnel replacement hiring for our vacant position within Human Resources. We're currently operating on a staff of 3 instead of 5, which is, even at 5, is a fairly small staff for an organization this size. And we really need to get that position filled. It was vacated in May.
And while I wasn't part of this, my understanding is that as a department, the decision has been made to no longer budget for next year for the part-time or the swing person.
Correct. We had a part-time role that was strictly for filing, and that has not been budgeted for next year, nor has it been filled this year.
And I'm going to go on a limb and suggest that, which is probably inappropriate, but I'm going to say it anyway. Suggest that we installed and asked for a vote of support for employee benefits electronic management system that was costly. It was shared between Human Resources and IT. We were very honest that we're going to do our best to implement this, but we're going to bump our heads a couple of times. I think that went extremely well. And if the byproduct of that is we don't have as much paper that we're shuffling and filing and everything else, and there's a savings of a part-time person that automation has helped with, I'm again going to say thank you to my fellow commissioners for the leap of faith and look what the product has done. And then Jamie will of course tell you I'm so far off base on that there's not a correlation there, but hopefully I am.
I think you're correct. I think it's a combination of the automated benefit system as well as streamlining some things within the office that has enabled us to make that savings and function efficiently without that position.
Thank you. And the person that you're looking, or the resolution that you're looking for today was within the budget matrix that you presented last week.
Yes, it's budgeted for 2021 and is included in the 2022 budget that I presented.
Perfect. Mr. Kenyon, do I hear a motion?
I move.
Alan
Bates?
seconds.
Allen seconds. Any conversation? Please call the roll.
Allen,
Allen, I.
Bates,
Yep.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Lewis.
Lewis, yes.
Thank you.
All right, item D is just beyond my depth, and Jamie, I'm going to really lean on you for this one.
This is a resolution to authorize the county to contract for the next 12 months. This would be for the calendar year of 2022 with Humana to provide the healthcare continuation coverage for our Medicare eligible retired and disabled employees. When a retired or disabled employee reaches 65 years old, they are put on our Medicare supplement plan with Humana. This is our current vendor, and we've had very good luck with them. The rate is going up $12.84 per month per individual enrolled in the plan. After consulting with our broker, Mike Baker, regarding the increase, he said that's a very industry standard increase and still is providing us what he believes to be the most cost-effective product for our retirees. That cost is paid by the retirees, not by the county. So it doesn't affect the budget since that retiree pays the entire premium.
Bates moves.
And again, before we take this, and again on this, for those commissioners that are attending and listening in, this was, Jamie, correct me if I'm wrong, this was one of those programs that was a radical departure from what the county was doing. We handled these retirees one way. Our outside professionals came in and said, if you handled this a different way, not only would you be providing better coverage for those individuals, it would be a cost save for the county. Just thought outside of the box. Nobody in-house did this. Mike Baker's team presented. It was a no-brainer. We instituted this. I think it's gone extremely well. Have you had any complaints or residual?
No,
Anybody
it has,
on the program? Because I think they're thrilled.
yeah, it has gone extremely well. It takes advantage of Medicare for those that are Medicare eligible. So they really do get better coverage using the supplemental plan. And the details of the supplemental plan are included, and you'll see that it's 100% coverage for almost every
It's
covered
so
service.
much better than they were getting.
Mhm.
And it's so much less expensive. It is a true win-win, but it was definitely outside of the norm. If this is what the county did for 20 years, we suggested something different, and this is one of those that has just been successful. Motion by Bates. Do I have a second?
Allen, seconds.
Seconds. Mike, she's beating you every time now. Any comments or concerns? Please call the roll.
Allen,
Allen, I.
Bates,
Bates, aye.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Lewis.
Lewis, yes.
Passes.
Thank you. Jamie, item E.
That was just a matter for discussion. I know we're out of time, and if you'd like to push it to a future month, you certainly can.
Let's just see if we can dive into it just to introduce it.
So what I'm looking to introduce is a compensation analysis and management plan, and just to introduce the idea and get the county's feel, the committee's feel for if this is something we would like to pursue further. Right now, for our non-union staff, we have a very noted wage gap where many of our employees are paid well below market rate in their positions, which makes it difficult to attract and retain quality employees. To make a study of market analysis in those positions is a very big project that would likely take 12 months. The report that would result would require the county board to look at and make a plan for reaching the compensation levels that are appropriate. And we would need to contract with a professional consultant to complete that project.
Jamie, has this ever been done in the past?
Last done in 1994. So it's been a long time.
So just, if anybody knows me, I do not subscribe to the, what are our neighbors doing and that's what we should be doing model. I believe that if you want the best, then go out and get them and pay them what they're worth. You know, if you don't, then don't complain when you don't. But this comparison, you can't deal with conjecture, and at some point in time, you need to have data. And if our data is from 1994, it's not even remotely relevant anymore. So I would like to see us possibly move in this direction. I don't have any shape for this yet. I'm not suggesting anything other than I would like to begin bringing this up for conversation and take it from there. So that we're not looking for anything today other than to introduce it, and we'll have more in subsequent meetings. Is that fair to say?
If it's something that the committee would like to pursue further, then I would make a proposal that would essentially show what the RFP, we would have to RFP for the consultant in this case. So I can take a look at, this would have to occur in stages. The first stage would be getting job descriptions from all the departments and, making an analysis of those, followed by market analysis, followed by a plan to reach those levels. So if the committee is interested, I can look at having an idea of what that RFP would look like for some consideration at a future meeting.
I'll go out on a limb and say, why don't you begin some preliminary analysis of what that might look like to bring to the next committee meeting? But if you could get it out to us in advance of the committee meeting so that we can amongst ourselves begin debating this and I mean, everybody will have input on this. I think that would be spectacular. So.
Okay, will do.
Okay, and before you leave the podium, this wasn't on the agenda, but one of the old business items that we have, the ethics, I don't even know how to shape this statement, but we're looking to jump in and tackle some ethics reform at the county level. And we had made the commitment here in committee that we would take that on. And if it became too large or burdensome, or we didn't have the professionals or the abilities within committee, that we would urge Madam Chair to go to a special committee to put that together. I'm not sure where that is. We've had so many moving parts at the county-wide level that I don't want to concede, Madam Chair, put together a special committee and just burden somebody else because we're going to kick the can down the road. But on the other hand, we should begin taking shape on what the scope of that might look like, so that if a subcommittee is formed, that we give them the guidance that they need. And I don't believe we've done that yet. So if I might be reaching out to members of this committee individually with an outline that maybe Jamie's team puts together to say, what are we missing? And Mo, are you still online?
Yes.
I think this was something that Dr. Iqbal was passionate about. It got sandbagged a year ago. It has probably grown in scope since then. But Jamie, Mo would be a good person to interface with to try and get a broad brush. This is what we're going to be looking to do. And then we'll begin designing the components underneath that. Mo, is that fair to ask you to help with?
Yes, sure, no problem.
Okay.
The state's attorney's office is assisting us with that as well, and they've made a review, and so they would be involved in that process also.
Is that Vincent?
Yes, Vincent
That young
Coyle
man has
has-
had trial by fire, man. And he's holding up well, and I appreciate him being here. So, okay, motion to
Mr.
replace.
Chairman?
Yes, ma'am, Miss Allen.
Just briefly, when we're considering salaries for our employees, I think we also should take a look at some of our executive directors. For instance, you mentioned Veterans Administration this morning.
Jake Zimmerman, yeah.
Yeah, and I think there are some others that we should probably take a look at too. We don't want to lose some of our really talented people on any level.
Deb, I'll tell you this right now. I think the conundrum that we're all facing is the short term, and again, I'm going to say something that I'll regret, but the short term and the immediate need, we have some monies that have become available that we can allocate and plug some of these holes, but that's not a long-term fix. And I know everybody's in a rush to do that. Well, we can do that and it can last 2 or 3 or 4 years, but then there's going to have to be this giant tax increase to cover what's not there. My suggestion isn't that. My suggestion is that while we're doing this, the county has used this notion or this model of we will let attrition weed out the people that are no longer needed to shrink the size of the departments. I think we're beyond that. I think we really need to do an analysis, department by department, get back to the mission statement, the goals of each department, identify their org chart, their flow, what's being done, identify purely, do they have enough staff? Do they have too many staff? How do we go with that? While at the same time putting together this salary range. And I would be remiss if I encouraged one without the other. I would truly be derelict. And I want to hold true to who I am and what I'm trying to do and just make that statement. And again, Cliff, what does that look like? I don't know yet, but that's the goal, to be running in tandem. So Jamie, have I voiced that to you?
Yes, and this process would include really both parts of that. The first step of this process would be to get good job descriptions and org charts for each department to look and see what people are doing, what their responsibility level is, and then equate that to the market value of their position.
Perfect. Perfect. Okay, motion to report, place reports on file.
Alan moves.
Alan moves, Bates seconds. Any discussion? Is that roll call? Let's roll call that and get her done.
Allen,
Alan, I.
Bates,
Bates, aye.
Igbo,
Iqbal, yes.
Kenyon,
Yes.
Lewis.
Lewis, yes.
Thank you.
Motion passes. I don't know that we need to go to executive session at all, but let me,
Better not.
no. So let's go. Ms. Bates, do you have any questions, comments, concerns, anything we missed?
Not at this moment.
Ms. Lewis?
Nope.
Deb?
We're good.
Mo?
I'm all set.
Michael?
No.
Ken?
Don't, oh my God.
Okay. I
Just
had you. Sorry.
Mr. Kenyon's usual motion.
Okay, Mr. Kenyon, can we have a motion for adjournment?
We adjourn.
Mr. Shepro seconds. All
I
in
can't.
favor?
Oh, yeah, I can.
Aye.
Never mind.
All opposed, nay. Motion carries. Thank you,
Thank you,
everybody.
Ms.